Hello, this is Professor Marvel with your week 4 content recording. So the concepts being covered in week 4 are special vulnerable populations, specifically pregnant adolescents, LGBTQ populations, mental illness, and alcohol, tobacco, and other drug problems. Please don't forget to read you have book readings in the Med-Surg book, chapter 47 and 48. Chapter 47 is care of patients with anxiety, mood, and eating disorders. Chapter 48 is caring with patients with substance-related and addictive disorders. And then you also have some chapters in your fundamentals book. You have a page in chapter 11, 159. And then chapter 41, the common psychosocial care problems of the older adult, pages 855 and 856. And then you also have some reading in your intro to peds and maternity, chapter 19, a few pages in that, and chapter 20, page 475. Don't forget about your Canvas readings. They're excellent this week. There's a Canvas reading embedded in your module with regards to pregnant adolescents, LGBTQ, and mental illness. So please make sure you read that. So just a quick introduction. We'll be covering these more in detail this upcoming week. What do we know about special vulnerable populations? Okay, we do know that vulnerable populations often have poor health outcomes compared to other populations. We've talked about that in previous weeks with regards to morbidity and mortality. High prevalence of chronic illnesses, increased risk for communicable diseases, TB, hepatitis, STDs. Okay. Let's talk specifically about pregnant adolescents. Okay, we know that there is a direct correlation that exists between poverty and poor health outcomes for this population. Okay, we know that poor teens are 3 times more likely to drop out of school. Okay, we know that our goal is to try and keep them in school. Okay, so when programs are available to assist the mother to complete her education, the chances are increased for a better future for both her and the child, right? And it also improves the health care over the long term, over the lifespan. Okay. We know that another vulnerable population within the pregnant teen is the pregnant teens who are homeless. They have several additional challenges. They have higher rates of STDs, higher incidences of addiction to drugs and alcohol, poor nutritional status, and then higher risk of poor birth outcomes, right? We know that racial and ethnic minority groups have higher rates of teen pregnancy. Okay, they may have higher risks of poverty, maybe higher risks of lacking adequate educational opportunity, higher rates of abuse, violence, sexual victimization, right? Some factors that contribute to teen pregnancy: low income, lack of education, lack of social support networks, maybe increased risk with the current living environment. Are they exposed to abuse, trauma, neglect? Okay, what about a adolescent or a teen pregnant client that's experiencing domestic violence? What do we do? We'll talk about this more in class, but think about a safety plan. What should be included in a safety plan for this teen pregnant mom? Okay, and then we also have to consider home visits. You know, after this teen mom has had the baby, and we're doing postpartum visits, what do we want to acknowledge? What do we want to make sure is going well? What would be some red flags? You know, certainly we want to be trying to observe or hoping to observe good bonding, that she can respond to her baby's needs. Okay, that she's aware of growth and development. Those are some primary goals. Okay. with regards to the LGBT population, right? So we as nurses have an obligation to provide culturally competent care to LGBT families, right? There may be some nurses who feel a level of discomfort when discussing sexual orientation with this population, right? But we have to try and overcome those barriers to care for this population, right? We need to establish that trusting relationship we've talked about in previous weeks with regards to working with vulnerable populations. Okay, we need to have an understanding of our own feelings when providing care, right? So that we are comfortable having those conversations with LGBTQ without any judgment, with compassion, without any preconceived notions. Okay. With regards to mental illness, again, the foundation of a good nurse-client relationship is understanding our own self-awareness, right? Our own understanding, our own beliefs, biases, feelings, and values with regards to a population that may have individual that may have mental illness issues. Okay, we know that anxiety, with regards to mental illness, we know anxiety is expected. It's a common emotion. It's considered normal and healthy unless it becomes debilitating and it impairs our functioning, our daily life, or we're unable to accomplish our daily tasks. There are a couple of particular mental health diagnoses I want you to be aware of. One is bipolar. We'll talk about these more in class. OCD, obsessive compulsive disorder, PTSD. And what about the client with suicidal ideations? We do know that children are at very high risk and very vulnerable for mental disorders, right? Maybe secondary to adverse circumstances or in kids who are living in at-risk environments and are having constant disruptions. They may live in poverty. They may be a victim of violence. They may be a witness of violence. With regards to alcohol, tobacco, and other drug problems, we know that substance abuse overall contributes to teen pregnancy, HIV, STDs, domestic violence, child abuse, motor vehicle crashes, fights, crime, homicide, assaults, suicide. We know that a person's current health may alter the drug's effects from one day to the next. Some people are genetically predisposed to alcoholism or other drug addictions, right? Maybe their chemical makeup is such that simply consuming a drug triggers a disease process for them, right? The other thing that's common with alcohol and tobacco and other drug problems are comorbidities with mental health diagnoses. There's some terms that I want you to be familiar with regards to this concept. What is substance abuse compared to what is drug dependence? What is drug dependence versus drug addiction? What is alcoholism? What is polysubstance abuse? Okay. And some particular substances I want you to pay attention to as you're preparing for class are some specific substances: nicotine, tobacco, vaping, e-cigarettes, alcohol, cocaine, amphetamines, methamphetamines. And then the last part is how do we set up community-based activities aimed at substance abuse prevention? And we'll talk about that more in class. Can we set up school programs that offer primary prevention activities, talking about the dangers of using drugs and alcohol and different substances. We also want to talk about secondary preventions, which is screening for risk of drug abuse, screening for risk of alcohol abuse, screening for risk for suicidal ideations. How do we include the parents and get them involved? But a lot of what we'll talk about in class is what are some primary, secondary, and tertiary interventions we can use with regards to alcohol, tobacco, and other drug-related issues. Okay, so we'll get more in depth, but that's an overview of the concepts we'll be covering in week 4. Thank you.